Now I would like to invite Dr. KS Chandrakanth to present a video on intraorbital foreign body measuring, 6 inches removal without anesthesia and investigation.
Good afternoon. Actually, the video was with the presentation was sent to the scientific committee, but they told there's a corruption in that video. So I'm giving a brief history. This is a patient, a boy, college student who came to my hospital around 7:30 in the night. That was a pre-Onam day. Onam in Kerala is celebrated for 3 days, and it starts on the pre-Onam day. And most of, especially we doctors, we take a 3 days leave on those 3 days. So you can't find any doctor in a hospital because we go on a tour, whatever it is. So this patient, he was little drunk because, as I said, Onam was celebrated within 3 days. First day, these people, college students, had gone for a tour or something like that, and they had drunk, and he was on the effect of alcohol. While driving 3 people in a bike, he was a driver. He fell down. There was a drizzles also. There was a rain. He skidded and fell down. Then his head hit the fence, and then he didn't know what has happened. Finally, this stick, a foreign body stick, entered into his orbit. He went to 2 medical colleges where he was seen by the residents. They were scared of seeing at the foreign body, so they told there is no seniors here. There is no radiology department also working today because there are no radiology people there. So they sent him. He then went to 2 more eye hospitals. There also he was taken back. But then he came to my hospital. I had some 4 or 5 patients waiting in my OP room to be examined. I told him I'll finish that and let you know. And he was little drowsy. So I made the sisters, my nursing staff, put some antibiotic drops into the eyes and put some local anesthetic drops on the injured wound. Then after my cases, I examined the other eye, the same eye also. People was good, and because he was drunk and drowsy, I couldn't take a proper vision. But finger counting, he told me exactly what are the fingers which I told. Then I took a written consent because he was unable to give a written consent. His friends gave the consent, and with all such precautions, I attempted. I had a small experience of having removed such foreign bodies maybe 2 or 3 inches in the past. So keeping that in mind, I started. Then the video is to be seen. Yes. On. Volume. Just see that. See that. Just see that. The size of the stick. See that. It's roughly 8 inches. It was 8 inches. Then the suturing was done. The wound was sutured. Immediately I shifted him to the local hospital where my friend was there and told him to take the systemic care. Then he was put on antibiotics for 5 days, intravenous for 5 days. And after 3 days, a CT scan was done. There was some soft tissue damages, no injury into the bones, or nothing was there. He had a vision of 6/6. This is wound suturing, that's all. Stop it.
That's a very interesting video. Do you also have an anterior segment a video post after all of this initial management was done? Because the entry of the wound appears to be oblique. So
Yeah.
it's my first impression looking at when you were pulling the stick out is that it's going to be a case of globe penetration as well.
Nothing was there. Nothing was there. No.
Were you able to get a video of the?
But then he didn't come to me after that.
Okay.
He ran away from because what has happened was his friends had taken a video and it went viral. So he was scared. And it came in the newspaper, local newspaper, or it came. And he was scared, and he asked me who took the video. I didn't take a video. I didn't take it. It's his friends who did that and spread it. And luckily, unluckily, they told my name also in the paper. So that also came. If you want, I can show that also.
Chandrakanth, excellent video, and I think you should name it Divine Intervention.
What about this?
Absolutely.
Yep.
Because, getting back 6/6 vision from this is an exceptionally challenging video, a dramatic video, and I really wish that he had followed up with you properly, and it was not Onam time, and the pre-operative or the pre-removal workup, is something that is of great importance, because in such cases, you are absolutely blind to what amount of damage has been done to the globe, to the orbit. So at times it is a tamponade by the foreign body to any of the ruptures that the globe might have gone. So it can become catastrophic if that tamponade is taken out. So a full proper CT scan, ultrasound, as well as the evaluation of the anterior segment, and if visibility permitted, the posterior segment as well. And then the last would be, of course, removal of the foreign body.
Yeah, because in fact I spoke to, ranked 2-3 of my close radiologists to have a scan, but they are all out of station.
Yeah, I know.
So then I told him, see, this is the risk involved. If you want, I can do that, but I took a written consent from them. Then only proceeded. Then only proceeded. I took all safeguards, especially in this part of our state. It's very difficult. The medical, legal, and all is very, very difficult. It doesn't run on lakhs. It runs on crores. Any damages and all. I have taken all precautions. Yeah.
So I just wish for the scientific part of it. If all these could have been done, that would have really made it into a video which ophthalmologists would have viral. So very good.
Yeah. Thank you.